Testing for astigmatism. Astigmatism is an irregular curvature of the cornea or the lens of the eye. It can cause light to be focused in more than one place within the eye, which can result in a blurred image. 33% of the population has astigmatism in one or both eyes. Astigmatism can cause blurring of distance and near vision. So, in addition to focusing errors that accompany nearsightedness, farsightedness, or presbyopia, the greater the difference in the curvature from the norm, the more difficult it is to focus. Your optometrist will check for astigmatism as part of the vision test. Using a phoropter or a trial frame, they will present a series of lenses and ask you to look at circular targets, then state when they appear clear and round. Astigmatism does not go away. If it is mild, you may have no symptoms and require no treatment. If it is significant enough to cause blurred vision or eye strain, then it will require correction with glasses, contact lenses, or even laser surgery. The level of correction needed can be added to your prescription. If you wear contact lenses, the degree of astigmatism can also have a bearing on the type of contact lenses you can wear. Your optometrist may also need to take an exact measurement of the shape of the front of the cornea, as well as the amount and alignment of the astigmatism using a keratometer or ophthalmometer. Your optometrist will either show you a pair of concentric circles, which is on the right side, or circular patterns of dots on the left. With your chin and forehead supported, the optometrist will shine a target onto the cornea. By observing its reflection in the keratometer eyepiece, they can measure the surface curvature. Thank you for your attention.
Let's now go to identification of patterns. Let's discuss concept of disease in Chinese medicine. The concept of disease is different in Chinese medicine than in Western medicine. In Chinese medicine, a disease is actually a symptom in Western medicine. For example, in gynecology, painful periods is a disease category, whereas in Western medicine, it is a symptom. And Western medicine would attempt to find a disease such as endometriosis causing the symptom of painful periods. Other examples of diseases in Chinese medicine are diarrhea, constipation, cough, breathlessness, dizziness, headaches, epigastric pain, abdominal pain, and others. As can be seen, these are all symptoms rather than diseases in Western medicine. Here we can see the relationship between Chinese disease and patterns. However, there is no reason why it should not be possible to apply Chinese-style pattern differentiation to Western medical diseases, and indeed many modern Chinese medicine books do just that. For example, the Western medical disease of coronary heart disease broadly corresponds to chest painful obstruction syndrome, or chest P, in Chinese medicine. If we were to examine and perform a Chinese medical diagnosis on a large enough number of patients suffering from coronary heart disease, we would be able to identify the most common patterns displayed by those patients. Given the hospital structures existing for Chinese medicine in China and the large number of patients using them, modern Chinese doctors are in a position to apply Chinese pattern differentiation to Western medical diseases. Another example that springs to mind is that of endometriosis. As the chief symptom of endometriosis is painful periods, we can treat this disease by referring to the Chinese disease painful periods. However, if we analyze the patterns displayed by a large number of women with endometriosis, it is equally possible to make a Chinese pattern differentiation of endometriosis. Indeed, in some cases, a pattern differentiation according to a Western rather than Chinese medical disease can enhance our treatment. Endometriosis is a good case in point. There's a general consensus in modern China that the migration of the endometrial tissue outside the uterus must be seen as a case of blood stasis. If we rely purely on Chinese diagnosis and pattern identification, in many women with endometriosis, we may not see signs of blood stasis. The tongue is not purple, the periods are not very painful, there are no abdominal masses, and therefore not apply the important treatment methods for invigorating blood. Of course, there is some correspondence between Chinese and Western diseases. For example, the Chinese disease epigastric pain obviously may correspond to Western digestive diseases, such as gastric ulcer, which presents with epigastric pain. However, there is never a direct one-to-one correspondence between a Chinese and Western disease. In the above example, very many people will suffer from epigastric pain without having a gastric ulcer. Finally, in a few cases, there is a direct correspondence between Chinese and Western diseases, with the two entities coinciding entirely. Examples of such identification between Chinese and Western diseases are epilepsy, malaria, dysentery, and measles. To summarize, a disease in Chinese medicine, like painful periods, is actually a symptom in Western medicine. The discussion of diseases may be found already in the Yellow Emperor's Classic of Internal Medicine. Thank you for your attention.
Foot tie-in spleen meridian. We discuss spleen 7, low Ku, dripping valley. Located on the middle side of the leg on the posterior border of the tibia, 6 tune proximal to the prominence of the medial malleolus, or 3 tune proximal to spleen 6. Spleen 7 strengthens and supports the spleen. If spleen chi is not properly regulated, food or ku chi will be lost, leading to fatigue and weight loss. The point is located in the longitudinal gully formed by the calf muscle. This location, together with the idea that this point drains damp from the spleen, provides the association with the name. Harmonizes the stomach, clears damp, disperses swellings. Indications: cold and numbness in the thigh, weight loss despite normal food intake, abdominal distension. This point strengthens the spleen. It is indicated for swollen ankles, swollen feet, swollen abdomen, generalized edema, body saturated with fluid, which is a sign of damp. For people who eat without gaining weight, the essence is leaking out. Helpful for general fatigue, consider for cold and numbness in the thighs or numbness in the hands or feet. Although not a commonly used point clinically, low Ku, spleen 7, is indicated for wasting of the muscles and flesh despite normal eating and drinking. This condition is referred to by Li Tongyuan in the treatise on the spleen and stomach, which said there are also cases of thinness despite eating well. This is due to hidden stomach fire at the chi level, resulting in large food intake. Spleen deficiency leads to withered flesh. Indications and potential point combinations. For local numbness or pain, we combine spleen 7 with bladder 55, spleen 6, kidney 6. Evaluate for trigger points in the flexor digitorum longus, flexor hallucis longus, and tibialis posterior muscles. For micturition disorders, we combine spleen 7 with spleen 6, kidney 3, bladder 28, CV3. Thank you for your attention.
Let's now go to liver conditions. Let's discuss changes to lifestyle. When receiving acupuncture treatment, patients also often spontaneously change their physical lifestyle. Since the treatments seem to make them more aware of which of their habits are unhealthy. But as a general rule, long periods of inactivity are detrimental to the liver, since this encourages the physical stagnation in the body, which the liver abhors. And long periods sat at a desk under stressful conditions would be particularly damaging, since the mental and emotional stresses tend to worsen the stagnation. The body is designed to be used to be physically active during daylight hours. So incorporating a variety of physical activities into our day is key to maintaining the health of the liver and is a great way to dissipate the effects of mental and emotional stress. However, routine excessive exercise will tend to have a depleting effect on the body's key resources and in long term could be just as damaging to our health. One of the key principles advocated by Chinese medicine is balance in every area and aspect of life. Other liver conditions. The following terms are also used in Chinese medicine in relation to liver conditions. Once stagnated liver function is present, this tends to affect the function of the other organs and hence the production of the blood. And once this situation has been present for some time, this may lead to signs and symptoms such as blurred vision, night blindness, dryness of the eyes, seeing either light specks or dark patches in the field of vision, poor quality nails, including soft, thin, withered, or deformed nails, numbness of the limbs and weak muscles, pale complexion, pale lips, and increased tendency to experience muscular cramps and spasms. These signs and symptoms are thought to be produced by a combination of the stagnated liver function and the effects of poor quality blood, which itself came about due to the long-term stagnated liver function. In Chinese medicine, the condition is known as liver blood deficiency. If the stagnated liver function eventually affects the function of the stomach, this may produce a feeling of indigestion, discomfort around the lower front ribs on the left side, the location of the stomach, belching, nausea or vomiting, acid regurgitation, and a rising sensation of heat in the center of the chest or heartburn. In Chinese medicine, this condition is known as liver invading stomach. Here we have patient samples. First, male, age 14. The patient's parents split up when he was 10, and a year later he developed stomach cramps. His elder brother then left home, which he also found hard to accept. This case provides a textbook example of liver invading stomach. Next, we have female, age 32. This patient sought treatment for issues related to her menstrual cycle, primarily acne. This case also included a clear example of liver invading stomach, which in this case produced heat in the stomach, which manifested itself as acne. And if the function of the pancreas were affected, this could produce a bloated and tender abdomen, loose stools alternating with constipation and intestinal noises. In Chinese medicine, this condition is known as liver invading pancreas. Once the liver function has been stagnant for some time, this is likely to produce such symptoms as constant feelings of dissatisfaction, frustration, resentment, repressed anger, possibly leading to depression, and over time, the following symptoms would also occur: frequent bouts of angry shouting, violent rages, migraines and headaches with severe pain, and dizziness, vertigo, and tinnitus. In Chinese medicine terms, this condition is known as liver yang rising. Treatment of these conditions. All the above syndromes simply describe conditions that are either complications of stagnated liver function and can therefore be successfully treated by treating that condition, or are due to problems with one of the other main organs and would be addressed by treating the organ as well as treating the stagnated liver function, so that in the above examples, the stomach and pancreas would also be treated. Thank you for your attention.
Diagnosis by visceral organs. We discuss small intestine and urinary bladder illnesses. The most important illnesses specific to the small intestine is that of strong heat in the small intestine. Strong heat in the small intestine is mostly due to fire transformed from the passions, attacked by exogenous fire evil causing strong heat in the small intestine, or strong heart fire transmitting along the meridians to the small intestine. The principal symptoms are in the urinary: dark oliguria, burning, dysuria, or hematuria. Additional symptoms include red complexion, thirst, restlessness with insomnia, and aphthous ulcers on the lips and the tongue. The tongue tip is red or crimson, and the coating is dry and yellow. The pulse is rapid. The most important illness specific to the urinary bladder is due to gelling of dampness and heat in the bladder. This is mostly due to attack by exogenous dampness and heat, but can also result from dietary indiscretion, generating endogenous dampness and heat, which then sink into the urinary bladder. As dampness and heat accumulate and gel in the bladder, the transformation of bladder chi becomes abnormal. The bladder then presses on the urethra and affects the kidney. Urinary symptoms ensue. Typically, there are urinary frequency and urgency, yet the quantity of urine is relatively small, and there may be dribbling and burning pain in the urethra. The urine is yellowish red and turbid, or it may contain blood. Sometimes the urine contains sand granules or stones. There may be accompanying fever and flank pain. The tongue is red with yellow coating. Pulse is rapid. Thank you for listening.
Let's now go to advanced assessment of mental health disorders. Let's discuss case study review. Here we have a patient. Her chief complaint is, I'm overtired and can't sleep or eat. So JD is a 31-year-old female biology graduate student. She reports, I'm overtired and cannot sleep or eat. Miss D has lost 15 pounds over the past month and wakes up unusually early each morning. She no longer is interested in her hobby of tennis because she feels tired most of the time. Miss D is a good student, but she has not been attending classes on a regular basis for the past month and feels guilty about this. She denies suicidal ideas because it is against her religion, but feels depressed for most of each day and says that nothing is fun. This feeling has been present for 5 to 6 weeks. She states, I would like to feel better enough to resume playing tennis and attending classes. I just have to get myself going. Maybe a vitamin would help. She provides little detail to questions and talks in mumbled tones. She denies hearing voices and blames no one but herself for this condition. JD denies having a history of eating disorder, sexual or physical abuse, or depression. Ms. D denies recent trauma, illness, hospitalization, or surgery. She takes only aspirin for the occasional headache or muscle ache. Miss D's mother died of cancer about 6 months ago, but she believes she is over the death because of her return to school following the death. Her father has no known medical or psychiatric problems. She is the older of three sisters. Her sisters are alive and well. Her paternal grandmother was treated for change of life depression, and her maternal grandfather was a secret behind the barn drinker. Miss D is a graduate student. She is single and lives alone. She states that lately she has had trouble making it to class and keeping up with her studying. Miss D used to enjoy playing tennis but no longer has the energy to do so. She denies nicotine use, drinking more alcohol than 2 glasses of wine per weekend, and illicit drug use. She had enjoyed friendship with other graduate students in class, but has been keeping to herself lately. Miss D used to attend church regularly, but has been missing mass frequently. We have clues of fatigue and insomnia, and important points are many mental health disorders are associated with sleep disturbances. We also have says that nothing is fun and feels guilty, and anhedonia and guilt are symptoms of depression. Loss of appetite and weight loss, these are associated with depression. She denies hearing voices, suggests she is not schizophrenic. Here we have her information and history. So the history, I'm overtired and can't sleep or eat. HPI over the past 5 to 6 weeks, a history of depression, guilt, fatigue, insomnia, wakes up early, loss of appetite and weight loss, uh, having trouble making it to class, no longer enjoys hobby, denies hearing voices. Mother died 6 months ago. Medications, she takes ASA, ASA for occasional ache. For allergies, NKDA. For PMI illnesses, denies history of trauma, eating disorders, abuse, or depression. She has no hospitalization or surgeries. For FH, mother died of breast cancer. Father has no known mental health or medical problems. Paternal grandmother treated for depression during menopause. Maternal grandfather used alcohol, and 2 sisters are alive and well. The SH, she's a graduate student, not attending class regularly. Used to be a good student, keeping to herself, no longer attending church regularly. Denies nicotine and drug use. She also drinks 1 to 2 glasses of wine on the weekend. For ROS, the general, there's fatigue and weight loss. The cardiovascular denies palpitations or other problems. She denies skin rash. For respiratory, denies hyperventilation and other problems. She also denies eye problems. She has poor appetite. She also denies ear problems, but she has genitourinary or gynecological. She denies these problems too. Um, she also denies nose, mouth, and throat problems. She feels some muscle weakness. She denies lumps in the breast and she also denies headache. For physical examination, she weighs 110 pounds. Her temperature is 98.4. Her BP is 110 over 70. Her height is 5'6". Pulse is 74. And her RESP is 20. General appearance, cooperative, thin, tired-looking Caucasian female. Her skin is warm and dry. HENT, her PERRL, hearing grossly intact. Her cardiovascular, apical pulse palpated, regular rate and rhythm, S1 and S2 auscultated, no murmurs, rubs, or bruits. For respiratory, respirations even and unlabored. There are no gastrointestinal examination, no genitourinary examination. There's no involuntary movements of the musculoskeletal. Her neurological is AGOX3. For others, there's flat effect, provides little detail in answers, indecisive, and has difficulty concentrating. The lab test shows CBC within normal range, TSH 2.1 UVL, T3 total of 100 ng/dl, T4 total of 7.1 UG/dl. For special test, Hamilton's depression rating scale met requirements for depression, and her final assessment findings is depression. Thank you for your attention.
Acupuncture for emergencies for herpes zoster. Emergency acupuncture may provide relief for symptoms associated with herpes zoster or shingles, particularly pain and discomfort. Acupuncture can help alleviate nerve pain and reduce inflammation. It may also help manage stress, which can exacerbate symptoms. Use acupuncture on the herpes point. Use acupuncture around the skin lesion and the TRT, Sanjiao 6, and GB34. If the skin lesion is in the upper body, add Li11, Li4, and Sanjiao 5. If it is in the lower body, add spleen 6, liver 3, spleen 10. Apply 4 to 8 needles around the skin lesion in a declining way toward the center of the lesion, 1 to 3 centimeters beside the edge of the lesion. Choose the TRT points, the nerve under which distributes the lesion skin zone. The needle remains for 5 to 10 minutes and is twisted from time to time. The acupuncture is once or twice a day. Use fire needle acupuncture on bladder 13, 19, 20, and Ashi points once every 3 days. It usually needs 1 to 3 times. For the Ashi point, use several needles around the skin lesion. There are 2 ways of moxibustion. For the first, use a moxipile, rice size, on the skin lesion, which is the first lesion, and on another lesion where there are a lot of clustered blisters. Burn it until the patient feels too hot. Blow off the moxipile. Repeat this to another zone of the skin lesion once a day. If the lesion is not cured, repeat the moxibustion after 5 days. For the second way, burn a moxi roll, moving the roll above the skin lesion in a linear way along the long axis of the skin lesion, or in a round circle from the edge to the center, or from the center to the surrounding edge of the skin lesion, and warm the skin lesion for 30 minutes. This needs to be done once a day for 4 to 7 days as a healing period. Use fire moxibustion on PC6 and bladder 40, or the lung 7 and Li4. If the lesion is on the arms or legs, add GB34. If the lesion is on the stomach, add stomach 36 and spleen 6. If the lesion is on the hip, add GB30. For this therapy, use a cotton wire. Dip it in sesame oil, burn it, and quickly touch it onto the acupuncture points. Once it touches the skin, lift it off. The skin spot may have a blister later. Leave it without special treatment. Do this therapy once a day with 4 times as the healing period. The pain should subside within 1 to 4 days. Perform flower needle tapping on the skin along the spine, 2 centimeters from the middle line of the spine. If the skin lesion is on the chest, choose the length of the whole thoracic vertebra. If it is on the abdomen, choose the length of the whole lumbar vertebra. There is also tapping around the skin lesion, not touching the skin lesion. Tapping is 3 times on every line, once or twice a day. Perform cupping on the skin lesion. The cup is retained for 15 minutes. If the blister is broken, use blister tape to cover it. This therapy is done once a day. Thank you for listening.
Let's now go to goiter, thyroid problems. Let's discuss phlegm and blood stasis. The clinical manifestations: goiter that is hard, possibly with nodules, painful, dark skin over the goiter, a feeling of oppression of the chest, insomnia, and anxiety. The tongue would be purple, swollen with a sticky coating. The pulse would be wiry. For treatment principle, we regulate qi, invigorate blood, eliminate stasis, resolve phlegm, soften hardness, and dissolve goiter. We can use acupuncture points. For distal points, it's triple burner 6, gallbladder 34, liver 3, pericardium 6, bladder 18, spleen 10, bladder 17, spleen 4, pericardium 6, stomach 40, ren 12, and spleen 6. The even method, except ren 12, which should be needle with reinforcing method. For local points, we use ren 22, stomach 9, Li 18, stomach 10, and Li 17 with even method. Acupuncture points, explanation, triple burner 6, gallbladder 34, liver 3, pericardium 6, and bladder 18, move liver chi. Moving chi is necessary to invigorate blood, pericardium 6 and liver 3, also to invigorate blood. Spleen 10 and bladder 17 is to invigorate blood. Spleen 4 and pericardium 6 to open the penetrating vessel which invigorates blood. Stomach 40, ren 12, and spleen 6, which resolves phlegm. Thank you for your attention.